Good afternoon and welcome. Welcome to the annual Rogosin Institute Symposium, focusing on kidney care innovation. I'd like to thank all of you for joining us this afternoon. We have roughly 350 participants that are joining us. More than 15% of the adult population is estimated to have chronic kidney disease. That's more than 1 in 7 adults across the United States. While there has been improvements in patient care over recent decades, there has not been a great deal of innovation. Innovation is needed to improve patient care and, more importantly, improve patient outcomes. Today, our speakers will discuss various treatment options and innovations over the years. I'd like to thank Dr. Jeffrey Silberzweig for coordinating today's symposium and thank our guest speakers for joining us today and their time and presentations. Tremendous amount of data will be presented during today's symposium. Today, we will focus and have our first speaker, Jeff Silberzweig, on hemodialysis, care advances, and improved outcomes. We will have Dr. Jeffrey Pearl discuss peritoneal dialysis, expanding patient outcomes and reducing complications. We will have our very own Dawn Edwards discuss chronic kidney disease, education, and peer mentorship. And Dr. Vinita Kumar discuss expanding the transplant universe and advances in immunology and xenotransplantation. It's my pleasure to introduce Dr. Jeffrey Silberzweig, Chief Medical Officer of the Rogosin Institute and Associate Professor of Clinical Medicine at the Weill Cornell Medical College. Thank you all for being here today.
So just a few housekeeping items to kick us off. This program has been approved for 2 CME credits and 2 continuing education credits for nurses and technicians. There is no conflict of interest with any of the presenters. At the end of all of the presentations, at the end of each presentation, a presenter CME code slide will be displayed. You must include these codes on your evaluation form to receive CME credit. A link to the CME evaluation form has been emailed to you, and a continuing evaluation form is not required. In terms of questions, all questions will be answered during the Q&A panel at the discussion at the end after the final presentation. Please submit your questions by clicking the Q&A button on the bottom of your screen and typing in your question. Note that only the host and panelists can see your questions. If you're having any audio issues and need to rejoin the symposium by phone, please call 212-225-8997, and I would encourage you to write that phone number down now in case there are problems. For questions regarding today's event, please email TAH9063@nyp.org.